I'm going to show you how to release the iliacus muscle on another human. This is the iliacus muscle right here. Here's the psoas muscle. And as you can see, it's right in the inside of the pelvic bone, the spot where it sticks out a little bit. This is called the Asis. So you can find that on your client by feeling the front of their pelvis to find where the bone sticks out the most. And we're going to be putting pressure on this part of the muscle. Now, you may notice that I'm kind of across opposite where I want to release. And this is really important for the biomechanics of the practitioner to actually be on the opposite side. And it's really important so that you can get that angular pressure that pushes in at an angle instead of directly down or kind of curving your fingers around. Like a lot of people will try to do it on the same side, like curving your fingers around. Number one, it's hard on your fingers. Number two, you cannot get the right angle to really pin the iliacus upon the bone. So finding the Asis here, the front, the bone sticks out the most. And then I'm moving my fingers just inside of that bone and feeling where the iliacus is. Now, iliacus is the size of your hand. It's not small, it's pretty big. So there's a lot of real estate to search around the inside surface of the pelvic bone. You may want to go a little bit up higher, close to the iliac crest. You may want to go a little bit lower towards where the inguinal crease is. Either way, you may find a really tight spot. Now, when you are putting pressure on that spot, it's important that you're putting angular pressure. So I'm going like at a 45-degree angle down, sometimes a little bit 45-degree angle towards the feet, if I want to get to the lower part where the iliacus and the psoas join. And sometimes I might even go up in this angle to get that, but making sure that you're actually using angular pressure to get at the muscle. And this is because the pelvic bone is shaped in a certain way that you need to have perpendicular pressure against the bone, which means angular pressure of your fingers. So if I find that bone, find it right inside there, I'm pushing down at this angle to press on the iliacus. And, you know, like I said, there's lots of real estate, lots of different areas to find, but once you find a tight spot, it's important to hold that pressure for at least 30 to 90 seconds. And you can see here, I'm able to kind of lock my elbows, I'm leaning in with my body, I'm using my own body weight, which is helping my own mechanics and my ability to hold it for long enough to get the required effect. So I had been doing this release for 20 years and have been getting really great results with my clients, not only in releasing tension here and the symptoms that were involved around the hip, but in how this muscle had impacted the rest of the body. People might come in, you know, to see me for foot pain, and I find out that their iliacus is actually at the source of their biomechanical issues. So this is why I created the hip hook. The hip hook is actually designed to mimic my fingers. The tip is actually just the same shape as my thumb that provides just the right amount of pressure to that muscle to release muscle tension. But instead of me having to do all the work, the client can do the work themselves. So if you can imagine lying on your stomach on top of this tool, this tip would actually go inside the pelvic bone and press on the psoas muscle and the iliacus muscle in the same way my fingers were. And then in addition, when you tip this underneath your body, you're lying on your stomach, this is going in, when you tip this underneath your body, you're getting that same angular pressure that I'm getting when I'm pushing on my hands in this position, which I have found to be the most effective over all my years of practice. So the hip hook is really designed to mimic what I could only do with my hands and what my poor little fingers were so tired of doing after so many years of practice. The other thing that I want to mention is that many people are more comfortable or more familiar with a psoas release. And when you first lie on the hip hook, it actually does press on the psoas because it's going directly perpendicular into the body. In the same way, doing a manual release, instead of doing an angular pressure, I can put a straight downward pressure to find the psoas. Now the psoas is just a little bit more towards the belly button, away from the pelvic bone. So just moving my hands just a little bit inward and kind of moving my hands back and forth in the abdomen to find that ropey psoas muscle right here that is tight. And then again, putting downward perpendicular pressure there to release that. If you release the psoas without releasing the iliacus, it's not going to maintain its relaxed state. Similarly, if you release the iliacus without addressing the psoas, same thing. These guys work together but there's two separate muscles and they both need to be addressed.